Hello and good day, guys. This is the Scrub Nurse PH, and today we are going to tackle the first video of a 4-part series about laparoscopy. Personally, I love the subject of laparoscopy. I find it very beautiful to see the clockwork process of its element. The high quality definition of the vessels and organs are just a sight to see. I can appreciate the anatomy of the human body a lot more than the times I assist with an open surgery where I have to predict what will come next without the advantage of seeing the operating field clear. So this is Introduction to Laparoscopy for my fellow nurses. Let us first define what is laparoscopy. The Oxford Dictionary definition of laparoscopy is that it is a surgical procedure in which a fiber optic instrument is inserted through the abdominal wall to view the organs in the abdomen or to permit a surgical procedure. Well, to explain it simply, we place a camera inside the abdominal cavity either to diagnose or surgically operate on the patient. Laparoscopy is also known as keyhole surgery, band-aid surgery, minimally invasive surgery, minimal access surgery, buttonhole surgery, and others merely call it LAPA. Above all of them, minimally invasive surgery is my favorite. It just sounds so classy. So what is MIS? Minimally invasive surgery is a modern surgical technique in which operations are performed, sometimes far from their location, through small incisions in the body. It is achieved through both specialized equipment to visualize and manipulate the body's organs, and a team of personnel equipped with laparoscopy knowledge and trainings. Laparoscopy can be both diagnostic and therapeutic at the same time. So why do we choose laparoscopy? There are several advantages and disadvantages we can enumerate, but for now let us start off with the patient. Okay, let's go over the advantages of laparoscopy for the patient. First, laparoscopy is less invasive than an open surgery, and because it has smaller incisions, the patients would have less post-operative pain and a shorter hospital stay. This means patients have a faster recovery rate. Laparoscopy also has a better cosmetic appearance due to its distinct small incisions. There are lesser chances of adhesions in MIS, and it would mean an earlier return to work or daily activities for the patient. However, the disadvantages of laparoscopy are, because of the specialized equipment that will be used, the surgery is more expensive. Another disadvantage is that not all patients are candidates for laparoscopic surgery. You need to have a cardiopulmonary clearance first before the surgery, because only general anesthesia can be used when doing a laparoscopy. Now, let us move on with the advantages and disadvantages laparoscopy has for the surgeons. An advantage of laparoscopy for the surgeons is that they have a magnified view. Surgeons can easily visualize the vessels surrounding the organs that they want to manipulate. MIS has an easier post-operative course, and of course, the unparalleled satisfaction after a successful operation. Meanwhile, the disadvantages for the surgeons are: laparoscopy gives them an altered but not absent tactile response, which means the sensation on the fingertips are altered because of the lap equipment they use. The surgery only offers a two-dimensional view of the operative site, and this is where a good cameraman would come in handy. There's a steep learning curve for surgeons. As my boss used to say in every surgery, there is no easy case in laparoscopy, and that we shouldn't underestimate any surgery. We should always prepare for the worst. Surgeons sometimes have a longer operating time in laparoscopy. This is sometimes caused by their need to develop different operating techniques than what they normally practice in open surgery. Now, let us tackle the advantages and disadvantages for the hospitals. The obvious advantage of our hospitals is that because of the faster recovery of the patient, there would also be a shorter hospital stay, which would result in faster turnovers. And a faster turnover of patients means double the number of patients that can be accommodated by the hospital. This offers a better marketing opportunity for the hospitals. The disadvantage, however, is that it needs an initial large capital for setup. Laparoscopy equipment is not cheap. With that being said, laparoscopy also has an expensive upkeep. Hospitals should provide specialized training for their personnel to take care of the equipment. Last but not the least, let's talk about how nurses can benefit from laparoscopy and also the disadvantages for them. MIS is an additional opportunity for a subspecialty for us nurses. This means that we have a chance to be an MIS nurse. This suggests that we would acquire additional skills because lap surgeries are very different from the flow of open surgeries. There are certain techniques used uniquely in laparoscopy that you cannot be exposed in other kinds of surgeries. The disadvantage, on the other hand, is that it has a more meticulous instrumentation. Given that the specialized equipments are expensive, lab nurses should be knowledgeable in handling such equipments. It has a more complicated cleaning process that requires a more careful and thorough handling and safekeeping. This will all be tackled later on my next videos. So what are the operations we can do in MIS? Here are some of the most common laparoscopic surgeries: cholecystectomy, hernioplasty, appendectomy, diagnostic laparoscopy, esophagectomy, gastrectomy, colon resection, splenectomy, pancreatectomy, and hepatectomy. I have prepared sample pictures of how laparoscopy looks. Here are the side-by-side comparisons of the surgical scars of an open and laparoscopic procedure. We can see that an open surgery of a ruptured appendicitis has a bigger operative scar than that of a laparoscopic appendectomy. Same story goes to a patient with bilateral hernia repair. The incision of a diagnostic explore laparotomy can go more than 30 centimeters, while a diagnostic procedure for laparoscopy only takes an inch of incision at the navel. So what are the roles of a nurse in MIS? So, to simplify it, us nurses need to make the surgery easier for the surgeon, always help to keep the patient safe, and take care of the machines and instruments. Thank you for listening throughout this whole discussion about my introduction to laparoscopy for nurses. This is the beginning of a 4-part series about laparoscopy, so stay tuned, like and subscribe, and slap that notification bell. This is the Scrub Nurse PH endorsing out.